Do you know of any of, and I don't know if you would know any of this, but with any of the survivors, it could be NASAR survivors or other survivors. Do you know much about their medical treatment afterwards, like how that has been? As we were talking of the other day, I was telling you, nope, I don't go to the doctor, so.
Yeah. So there's a lot of, there are a lot of problems. So, and we were talking about it. And if you're all following U of M, Dr. Anderson, who is now passed, he did prostate exams on thousands of men. And those men, and he would do that every month or more. And again, under the guise of treatment, it was very close to what NASAR had done. And as a result, they are now, having watched the NASAR survivors, they are now coming forward and forcing the hand at U of M. And Dr. Anderson went a step further and also took their semen. They feel violated, and was trying to make because he had an IVF clinic, was trying to make the greatest Black athlete ever. That's how crazy this whole thing gets. And so what happens? So I know from speaking with some of those survivors, they haven't gone to doctors. Many of them who needed to go to doctors were in stage 4 cancer by the time they actually went, because they did not want to go to a doctor. So they ended up with prostate cancer and died, or are suffering through it now. The same thing with those with NASAR. I'm not aware of any. There was one who died by suicide. There have been many attempts, but in the care, the medical community really needs to be trained on not just these kinds of survivors, but any survivor of trauma. There needs to be informed consent each step of the way. I'm going to touch you. Is that okay? Ask permission. Because many of the girls now are having babies. And instead of enjoying that process, as painful as it is, right? We're all excited. We're going to see this new life, and we're experiencing the pain and working through it. And we're smiling. We're still happy, after each contraction passes, I want to see that wonderful face. And every woman has a story about birth who's had children. Well, sadly, what they go through is a trigger. They're not enjoying the birth. What's happening is they go into a sort of shock. It's an ultimate all-time huge trigger, because there's hands up in there, checking their cervix, putting their hands way up in there, turning the baby, doing whatever needs to be done, which is normal, but it's not normal for them, because what they're doing is they're having flashbacks of the rape, of the trauma, of the assault. And that is true not just for the NASAR sister survivors, but for other survivors I have talked to. They don't go see doctors. When they do, it's totally traumatic. One woman contacted me, and she said, I have to talk to you. I have to talk to you. And she didn't have anybody else. She'd been raped by a coach, but she lost both her parents and her brother, tragically. And she didn't have anybody to talk to. And she said, I have to come and talk to you. I have to talk to you. Anyway, my secretary finally said, if you know anything about, how an office runs, be kind to your secretary. So I finally said, okay, set up an afternoon during my lunch hour, I can talk to her. So the woman drove about 6 hours to talk to me. We closed the doors. She did exactly what you saw with NASAR and what I've always done, for 17 years on the bench. I let her talk. And I had my court reporter in there, and I said, we're going to make a transcript of this. She said, no, I don't need that. I just want to talk to you. I just want to tell somebody. And I said, well, we're going to do it anyway. So she told me her story. She told me what she wrote, and then I engaged her, as I always do. And we talked, and I told her some messages that she could take home, and we had a great time. And you could see that a weight was lifted. And she did at the end say, I want a transcript. I don't remember what we just said. So I sent the transcript home with her, or it was sent to her a few days, but nonetheless, we ordered it. And she gave the transcript to her therapist. And her therapist said, you told Judge Aquilina things that we in therapy never even scratched the surface of. So it moved her therapy forward. They had sort of been at a stalemate. So jump forward a few months after that, she needed to go to a gynecologist, and she couldn't go. And then she had to go when she realized it. So she went in and she told them, I'm going to have problems. And the nurse stayed with her. And it took a couple of nurses to hold her down as the doctor was doing the test, putting all the instruments in her and all of that. And she was screaming, and she screamed out, Judge Aquilina told me I mattered, so I can do this. And yeah, and she told me this story. Well, she had to go back a couple of weeks later, but it was to the hospital. Very similar thing happened. And the nurse, who was almost the identical scene, but the nurse who was with her then, holding her as she was crying and saying, again, Judge Aquilina told me I mattered, so I mattered. The nurse very kindly said, I know that you matter too, so that's two of us who think you matter.
Wow.
Yeah. Now I don't even remember the question, but anyways, so I know that telling the story helps. Oh, I know that. And the medical, yeah, there's all sorts of triggers. People don't want to be touched. And so we have to have a whole new way. We have to understand trauma as part of the medical community. Each physician, physical therapist, whomever, needs to be trauma informed, and also have a connection with a trauma informed therapist or referrals, so that you can figure out, what to do with this individual, because they need and deserve medical treatment. But they're not going to just spread their legs and say, okay, give me my pap smear, because they can't handle it. And they do need to be seen. So we need to do the informed consent. We need to talk them through it, whether it's soothing music or an animal or whatever it is that will help them. There has to be the right prep work. And if there isn't, all we're doing is re-traumatizing them and setting them backward.